into the conversation.
Right, where are you putting this on Facebook?
This is going to be it's on my Twitter feed, ASRA's Twitter feed, Facebook for ASRA, and then ASRA's YouTube and ASRA Rap's YouTube all at the same time. Cool. So that's the kind of cool part about this is it pushes to all 5 places simultaneously. And I am just going to reshare this real quick from my page. I think it should come up on your pages already, on your Twitter page, with a posting of going live, because I put your usernames into it. I think I misspelled yours, I realized, Eric. So I will add you into the... I left an S out of your name. Well, I've never typed your name before, so...
Let's see, Twitter.
I misspelled yours, I realized.
Oh, yeah, you can hear me.
Sorry.
There you go. Put that there, and...
There we are. We are here. I see it.
And let me share this out. I'm just trying to tag a few people so that they might see it and join us. And I'm going to pin this up to there. All right, some people are joining. We got 18 viewers already, so we'll start in just a moment here, just getting everything tweaked. For those of you guys who are watching, if you want to leave comments in the comment stream, we'd love to see those. But it's 7:30, so I guess we'll start. Hello and welcome to the American Society of Regional Anesthesia and Pain podcast, ASRA Rap. I'm your host, Raj Gupta, and with me as always is my co-host, Eric Schwenk. Eric, how are you?
Excellent. How are you?
I'm doing great. It's been a little while. We've had some gaps in time, but we do the best we can trying to get back on here. And we have a really important reason to be on here today because we're going to be talking about the ASRA virtual fall meeting. And we've got our 2 co-chairs for the meeting with us today, Jaime Baratta and Magda. And Magda, I can never pronounce your last name right.
It's okay. Magda's fine. Magda.
No, you tell me correctly so I get it right.
Magda Anitescu.
And there's an extra syllable, Anitescu.
Totally phonetic. Romanian is totally phonetic.
Okay. All right. Magda Anitescu. There we go. I'll get it better. So both of them are joining us today. Before we get started, just wanted to remind you guys a couple of things. This meeting is coming up right around the corner. We're about 3 weeks away from the meeting. It's November 20th through the 22nd. It is a virtual meeting, so you don't have to make travel plans. You don't have to book a flight. You don't have to worry about which N95 mask you're going to wear to participate in this meeting. Just go to the ASRA website, register for the meeting. There's a lot of really phenomenal sessions. You're going to hear a little bit about that today that you can participate in. We all love this community. It's a great opportunity to interact with the community and really get refreshed on all the latest science for regional anesthesia, chronic pain, and you can really mix your disciplines in this opportunity. I'm going to put up the hashtags for the meeting at the bottom here. So it's hashtag ASRAFall20 or hashtag ASRA Worldwide 2020. And the worldwide is because, we're doing a virtual meeting, so we've been able to include more people from all over the world as speakers and participants. So this is going to be a worldwide opportunity. So follow these starting now. Start looking at these hashtags. There's going to be more and more content on these hashtags leading up to the meeting and then during the meeting itself. A ton of traffic on social media. Connect with the experts in this area. It's going to be a great time. And let me pull this off. And so right with that, I want to get right into the conversation about the meeting. Jaime, I'll start with you. So you had the unfortunate task of having to cancel your meeting in the spring, which for those of you guys who don't know, years in the planning, years of work, lots of people involved, lots of effort and thought and late nights trying to work on spreadsheets, trying to figure out how to put this meeting together. And obviously nobody wanted it canceled. The world has changed a little bit in the last 6-7 months, but it had to be done. But ASRA was smart. We kind of incorporated some of your content, a lot of your content into this meeting. Tell me about that experience in transitioning to this fall meeting.
Obviously, the initial cancellation. I was, heartbroken, but understood, obviously, with the pandemic, and it was obviously the right thing to do. There was a lot of uncertainty there for a while, what would happen, and how I would be able to incorporate my meeting. But I would like to thank ASRA and also Magda for being, so amazing to work with and giving me, a portion of her space. I know it was hard for her to give up anything of her meeting, but it was really great to work with her, and the ASRA staff was great to work with. And, I'm just really excited to be able to have, some of this content, because especially a lot of my speakers had already been working on their talks, and just really to bring a lot of these important panels, I think would be really valuable to the membership and those attending the meeting, to life in this virtual meeting.
Yeah, and Magda, I'm going to run a similar question to you, and then I'll let Eric follow up after that. So you've had to adapt you had a little bit more notice than Jaime did, but you still had to adapt work that you had put together for years trying to lead up to this meeting. Tell me a little bit about that thought process and what that experience has been like over the last 6 months.
Yeah. So it's been, this meeting will probably be a meeting of as no other has been before, obviously. The meeting, as you, Raj, know very well, takes about 2.5 years to kind of prepare. So by June of this year, all the program was done. Everything was was basically ready to be done. And then we had to go virtual. And then not only that, but we had to contract the faculty and to the meeting to something a little bit less, because we're not going to be able to do workshops anymore. What is the silver lining about it is that we actually had to work together, chronic pain and acute pain. So basically, this is going to be a comprehensive meeting about pain in general. So it would be fantastic to incorporate acute to chronic pain, elements of chronic pain into acute pain, original techniques. So it's overall, it's going to be probably one of the best meetings ever, just because of this bringing together all the people, which makes ASRA such a great society.
So I guess one thing that maybe I'll ask both of you, if you wouldn't mind saying one advantage of the virtual format compared to live, and then one downside.
So if I may start, so the downside is obviously we're not going to see our friends, which ASRA is really feeling like a family more and more so these days. So this is one of the major downsides. But the good part about this meetings going virtual is that actually we can reach out to people which are a little more relaxed in different parts of the world. We have, for example, people from Australia, from Turkey, from UK, a speaker for the meeting. So we are able to kind of reach out corners of the world which we were not able to do before. So I think it's a great opportunity here.
No, I have to echo those statements. Obviously, we can reach more people, and people have the opportunity that may not have been able to go to the fall meeting, that usually just go to one meeting a year, go to the regional acute pain meeting. Those people will get to see a lot of the chronic pain content that they can learn a lot and apply, to their daily practices. So I think there's a lot of benefits. Also, I got to have, invite some different speakers that I may not have had the opportunity in the normal live meetings due to restrictions on, travel and faculty numbers. And of course, the negative is, in regional, workshops are really important, and we're not really going to have any workshops other than one, kind of interactive demo. So, that's unfortunate, but I know that the content will really be important and valuable to those that are attending the meeting.
Cool.
So I'm going to throw a little bit of the program up here on the screen. This is off the ASRA webpage. Chronic pain medicine topics, acute pain medicine topics, and then there's something called an ASRA track. Tell me a little bit about the ASRA track, Magda. What is this, and who should be doing this?
So ASRA track is a combination between between acute and chronic, basically. So you'll have sessions which are regional acute pain, but also chronic. Some of them are intertwined. Some of them, which on that, for example, are one of the sessions is detectives in pain medicine, which is basically was originally in my chronic pain meeting, but it actually applies to acute pain as well. So it can be some of the sessions here can be applied to both tracks as well. So this is why it's called ASRA track, and not other name. So it's just something which is combined both. I mean, all pains together, all pain management together.
And Jaime, these interactive sessions, so how do you do interactive virtually here?
I mean, it's obviously a challenge, but it's really going to be live sessions that are obviously everything's streamed live, but the speakers will be live. People will really be able to interact with these speakers, ask questions, relying less so on actual lectures, formatted lectures, and more specifically on answering Q&As with the audience. One of the ones I designed was the fascial plane demo, just trying to use the experts that we have to show off the different fascial plane blocks and give the audience time to ask questions, get tips on how to better do these blocks and when to use them and everything like that.
I think just having from the Zoom stuff I've done so far, it seems to me that people are more willing to ask questions because Zoom kind of keeps your anonymity a little bit, or it doesn't put you quite as on the spot. I think people are much more likely to have the courage to type something on the Zoom chat as opposed to get up and get the microphone and wait in line. So I'll be curious to see if there's better questions for the panelists and the speakers this meeting than some of the other panels.
Mm-hmm. Yep. Good point.
So Jaime, go ahead, Magda.
I think it's going to be driving more people as well in all of those sessions, because historically interactive sessions drove probably about, depend on the session, but at least for the chronic, drove about 20, 30 people at a time. But I think it's going to be more people which will be coming to those. And then, we can make it as interactive as possible. Some of my sessions, interactive sessions, they were actually pulled from the workshops. Like some of them for surgical techniques, you can actually demonstrate in an interactive session. Alternative medicine is also one of them there as an interactive session. So I think, they're going to be popular, I think.
Mm-hmm.
As somebody who normally doesn't go to the fall meeting, I'm kind of intrigued by some of these chronic pain topics that I normally wouldn't get to attend as out of my normal behavior. Alternative medicine, some of the things about implantable devices and stuff like that I find fascinating, and probably a lot to learn for those of us who don't do chronic pain on a regular basis. So Jaime, you had to trim your acute pain topics from your meeting. I mean, what jumped out to you when you had to go through that editing process and really figure out what stood out? What jumped out to you? How did you figure that out? And when you look back now on the topics you picked, how does this inform where ASRA is going?
I mean, I think, a lot of the topics I picked was really kind of sticking with a lot of what my theme was. I really wanted to involve a lot of enhanced recovery because I really feel that, anesthesiologists and specifically regional anesthesiologists and acute pain physicians can really be the leaders and the drivers of enhanced recovery protocols. So it's really, showing that, we can expand and really show a lot of value, not just in the operating room, but in the whole perioperative arena. So I really wanted that a lot of my focus. Also, I wanted to take some of the, aspects, of acute postoperative pain, more like the transitional pain, as well as persistent postoperative pain, and really bring that to this audience and again, talk about what we can do in the OR, what we can do in the immediate postoperative period to hope possibly, impact those outcomes and, provide, a better outcome for our patients. So that was a lot of how I chose those topics. I really tried to pick things that I didn't really think was always necessarily done a lot before in previous meetings.
I'm curious, some of these topics, do we have the involvement of any, I guess, non-anesthesiologists, non-pain physicians, like other specialists and that kind of thing?
I mean, I do have a couple of surgeons. I have, orthopedic surgeons for the ambulatory surgery, ERS for ambulatory joints, as well as ERS for spine. I have a spine surgeon speaking on that topic, as well as a joint surgeon will be speaking on challenges in patients that have undergone joint revision surgeries and how they may not really apply to standard ERAS protocol and what we can do differently to be better for them. I also have a mindfulness expert to be speaking both on mindfulness for physicians as well as mindfulness for patients in acute pain.
Yeah, that's great. I mean, I know some of the past meetings, some of those sessions were some of the most popular sessions. So I would imagine that would be the case again this year, especially like the surgeon involved meetings. It's always nice to hear their perspective, because sometimes we sort of put the words in their mouth, what they say, and then you hear something and you're like, that's not at all what they were thinking.
Hopefully we get invited to some of their meetings for the same purpose.
Right.
What is this one topic, physician moral injury?
That's all about physician wellness. I think now more than ever, talking about wellness is incredibly important, after what, just we as a society, especially we as physicians have gone through. We've experienced a lot and seen a lot. And, I think, wellness is something we need to talk about. And, that's really what that session is about, talking about the concept of burnout, different wellness strategies, as well as the unfortunate, fairly high incidence of physician suicide.
Is there other sessions that are specifically COVID focused in this meeting?
Yes, there is a specific COVID session in one of my tracks. I think it's at the end on the Sunday.
Let me see if I can pull up the more detailed.
Program.
Yeah, I'm gonna pull up the more detailed one here. Hang on one second. Yeah, it's
Go ahead.
Go ahead. No, please, Eric.
I was just saying, not that we all want to be constantly hearing the COVID, because we're hearing it every day from every other source, but I think you'd be incomplete if you didn't at least touch on it in some fashion, right?
So the session will explore the education, the research, and then the clinical part of the impact of COVID on those three missions. It's 1 hour session. It was supposed to be a plenary session, but if we will go in person, but it's still on the on Sunday, I think.
Yeah, let me get it scrolled to Sunday. So this is the ASRA. Is it in the chronic pain track?
It's in the chronic pain track, I think.
Okay.
So it is.
It's been interesting. I've been intermittently over the last 6 months doing these live streams, and this is still ASRA track, sorry. And talking to people all over the world, and the way that COVID has affected people in their practice, how they've had to be, how they've made adjustments, how that's affected them personally. All of that is so varied all over the world. Completely, there's some common elements, but some people have gotten hit a little bit. Some people have gotten hit quite hard, and adapted to it because they have to. This is interactive track. Did I miss it?
I think it's before the interactive. So if you scroll up now, it's just before it.
Interactive.
And just before it.
Oh, I think you just passed it.
I think you just.
Oh my goodness.
No.
Sorry. Right there. Here. Yeah. This is. Yep.
No, one more page, I think.
This is regional anesthesia and
Okay.
acute pain track. Where's the chronic pain
I
one?
forget.
Lost.
Did it get lost in the program?
Chronic pain is right
There
up.
we go. There we go.
There you
I got
go.
it. I
That's
found
it.
it. Okay.
Mhm.
All right.
So
Sunday, pain medicine in the time of the pandemic.
yes,
That's what
it
we're
is.
talking about. So
Yeah, that's what we're talking about.
arrested development, novel teaching tools to supplement trainee education, Don and Doff, in-person and virtual visits. What will we keep doing for years to come? Clinical practice in quarantine time. How do pain clinics around the world adapt and survive? Magda, that's really interesting. I think personally, and you can speak to this, I don't think we're going to go back. I think that there's going to be a component of virtual visits, especially for pain patients, where the travel is aggravating their pain. What do you think?
I think it's going to be for the foreseeable future. Virtual visits are really very useful. I mean, you don't necessarily. I mean, it is very nice to see a patient in person and do a physical exam, but the routine follow-up, for example, after surgeries visits or follow-up of the after procedure visits, those can be done virtual. So it's they will be here to stay. We'll just have to kind of learn how to do it better and more efficient. We're doing pretty good job at it, but just they're here to stay for sure. I don't think we're gonna go back unless CMS told us otherwise. But so far, we are doing okay. For a while though, so that's what's very important. I hope they're gonna touch on it. For a while, we did actually telephone visits, which, if you think about it, it's unheard of before the pandemic. So we actually talked to the patients at the phone, and that was considered a visit. So all kinds of things we did in March and April and May for this. So it will be interesting to see what the perspective is around the world. I don't know if it's Europe. It's going to be the same. Jose De Andres is going to talk about the pain clinics in Europe, for example, when they were hit very hard. So we'll see their perspective as well. How did they adapt to the pandemic and the new reality? So it's going to be interesting.
Yeah, these aren't exactly patients that can wait,
No.
for 6 months. They need to be seen. They need to be evaluated and followed up on. This is,
Yeah.
in the vernacular of today, they are essential patients. They have to be seen and taken care of.
Magda, I wanted to ask real quick if, or actually maybe for both of you, but is there anything that's going to be touching on the fact that the opioid epidemic seems to have kind of worsened in the background during COVID?
There will be not specifically related to COVID, but I think they're going to be touching on. There are several sessions on opioids, and there is also a very good interactive session about different initiatives in the hospitals to actually deal with the opioid epidemic. So there are several of them, specifically with buprenorphine and the X waiver to kind of prescribe Suboxone and other medications for addiction. So there are several of them scattered around all tracks, I think, because I think we have some in the interactive, some in the acute, in the ASRA track, and some in the chronic ones. So they're trickled everywhere.
Yeah, in my session, I also have a couple of different lectures to sort of address that. I have a session or a lecture in one of the panels talking about patients with opioid use disorder and buprenorphine management perioperatively. Also, I forgot, we do have a lawyer who was in one of my panels who's actually be talking about safe opioid prescribing and what's our legal obligation. And we also have Dr. Dart talking about, the risk of not just opioids, but also the risk of, the other medications we use in acute pain management and the risk of abuse.
Do you know when the lawyer talk is offhand or no?
Yep, I have it right here. It is on Saturday, November 21st at 1:15. It's part of my, time out for safety. Raj is actually moderating it.
Yeah, I was going to mention that. I will take full credit for the quality of the lecture.
That was an intentional segue. No, but actually, I just think that's cool because it's a I don't know, it's an external kind of speaker that we don't get to see a lot. I haven't seen a lawyer at another ASRA meeting, but I bet you it's going to be a really popular session because of the outside expertise, Yeah,
and he's a great speaker. I've heard him speak before. It'll be a great session.
Yeah, I'm always a big fan of bringing other disciplines into our conversations because we always run the risk of creating an echo chamber and congratulating ourselves for all the great work that we've done and not really integrate that into the overall care of the patient unless we bring these other components into the conversation. Surgeons, lawyers, your speaker on mindfulness, all these things kind of are important components of the care of the patient and care of ourselves in this process.
And to plug, Dr. Dart in that session was going to talk about, other drugs of abuse, is also emergency medicine and toxicology expert. So
yeah,
another perspective.
Yeah. I was going to ask you, Jaime, is in your sessions, where do things like point of care ultrasound fit into this constricted meeting? Do you feel like it's still integral enough to keep, or is it something that had to be waysided for a little while?
Oh, I did actually include it. I think that's up in the ASRA track, if I recall. I wanted to include something that I was really excited about for the live meeting, and hopefully it'll translate to this virtual meeting, was the pro-con debate. regarding, is the ultrasound the new stethoscope? And, has a stethoscope, thing of the past. So I think that'll be interesting talking about, I think it's Dr. Haskins will be the pro for the ultrasound, and Dr. Boretsky will be the con for the ultrasound replacing the stethoscope. So I think that'll be a really fun session to see them debate.
Yeah, I'm trying to find that. Is that on Friday? There it is.
Yeah,
Yep,
I think it's
there
one
it
of the
is.
first sessions.
Yep. And Hurry is who's watching us right now is the moderator, so he's commenting. I'm sure that will be a really fun one to watch. I kind of feel sorry for Steve because I think Karen's gonna run right over him.
She very well right.
I don't think he's got a chance. So we'll see how that comes up. So, what jumps out to you about how we create a meeting that mimics some of the camaraderie that we feel during in-person meeting? What have you guys done to try to recreate that? Jaime, why don't we start with you? It's not the same, but I know you guys have tried to incorporate some of these interactive things.
I mean, yeah, I think, picking things, having interactive demonstrations, interactive sessions, and really try to make sure we're keeping the lectures, down to about 10 minutes or so, making sure there's a lot of time for Q&A so we can interact with the audience and answer questions. So I think that's what's really important. We want to have the lectures, a lot of, content there, but, I want really to have that time for the participants to really interact with those speakers, ask their questions, and have thoughtful conversations about these topics.
And Magda, how do you think that we're going to maintain that camaraderie during this meeting?
So there are two ways. I think the the true interactive sessions will do it, part of it. And then the other one is that, as Jaime said, majority of the lectures of the lectures and the sessions are basically 1 hour with 10 minutes per each speaker. In chronic pain, for example, what we did is that we created a deep dive over specific sessions. So the people will actually go and see the 3-hour recording, and then come prepared with their questions and their comments. Hopefully, it's going to be making it more interactive. So about 7 or 8 sessions are structured this way, that they have a 1 hour presentation live, and then a 3-hour deep dive where the topics are discussed in depth. So we hope that this is going to be conducive to some discussions live during the meeting. Nothing obviously substitutes the in-person, but hopefully this is going to be as good as we can actually get to it. I think it's going to be very, very interesting and very nice to kind of see how we can actually evolve to this venue, to this way of doing meetings.
And I will say also that there are some special events. I mean, I know that there's been a call, for music, for people to, show off some of their talent. So I think that can add to the camaraderie. I'm sure I expect Eric to be showing off his skills on the drums. But also there's different, we're trying to keep some of the events like the Saturday night party. There is going to be, kind of a dance competition where hopefully people could show their moves. I think there's a mixologist going to be showing off making drinks. Also the welcome reception, be able to really interact with different vendors. I think there's also some sort of chat rooms you can join and talk to sommelier about different types of wines. So there's different things where you can interact. I think there's a meet and greet for new members to interact in different chat rooms. So while we can't really be physically in the same space, there is opportunities to network and talk with other members and the ASRA faculty as well.
Yeah, I mean, I think you guys have done a yeoman's effort to try to maintain some of the nuance and some of the special side things that go on at these meetings that we look forward to. And it's not quite the same, but it doesn't mean that it doesn't have to be good. We're just innovative in this process. And the call for music, that was what I was going to pull up. If those of you who are interested, I think they're looking for people to send them something by tomorrow, right? Do I have my dates right? October 30th. Yeah, so the deadline's there. So, if you want to submit something, a video of you doing musical talents of some sort, I will not be submitting a thing because I have no musical talent whatsoever and completely tone deaf. So I will not be good for this at all, but I will enjoy other people's musical talents profusely. But I encourage people to put stuff out there. It's always great to see all the different talents people have beyond just their skills in anesthesia and pain medicine.
Yeah, I would put in a plug for that because otherwise it may just be a couple of videos for me. So it'll be nice to get some variety in there. I did a couple. It's pretty simple. You upload to YouTube. It takes a couple minutes. You can do it with your iPhone or your Droid phone because actually the video quality is pretty good. So yeah, definitely go for it. Just do it by tomorrow.
Eric, this isn't a live jam session. I don't get to send in requests and put different things on your queue to do.
Maybe if you put it after the cocktail hour.
I just don't know how that'll translate. We'll have to see. So, but I look forward to seeing people's submissions because I'm sure there's a lot of creativity out there. What other things do you guys want to talk about? Magda, is there anything else you want to mention? I know there's a lot of innovation and creativity and hard work went into this meeting. I want to make sure that you guys have a chance to share that. But the most important thing is I want to make sure people register and participate. So any other thoughts or comments you want to make, Magda?
Yeah. So first of all, I have two comments about the message for the meeting per se. So the theme for the meeting is actually perfect 2020 perfect vision because it's just so fitting that this is 2020 year 2020, and then it was a very nice pun. But the thing is that what this meeting will bring, at least from the chronic pain part, is that it's going to be a very deep dive and very clear understanding of what pain medicine is at this point in time. So we will align everyone with what it is pain medicine in the year 2020. And the other thing, which is very important, is that this meeting is probably one of the few in the chronic pain time that incorporates many, many, many specialties. So we will have psychiatrists, we have PM&R people, we have surgeons, we will have a neurologists presenting at those sessions. And what is interesting about it is that they will offer a different perspective. So one of the sessions, for example, is called specifically In Each Other's Shoes, taking one problem and just like looking at that problem from different perspective and different views, pretty much in a way to see how we can actually collaborate more, and then how we can actually improve our outcomes. Many sessions. I will spend an hour just discussing about them, but it is really important to come to the meeting, because it's going to be a meeting which is going to bring all of us together. So whether we are acute pain, chronic pain, specialists in pain, or specialists somewhere else dealing with patients in pain, I think it's going to be a meeting which is going to have something for each of those people. So I would really encourage to come and register for it.
And Jaime, any other thoughts that you wanted to share about this meeting that I think elevates this meeting and not diminishes it, because I think you guys have done a remarkable job combining it and making this something special?
I mean, I think, it's being a virtual meeting, again, you don't have to travel. You have everything right at your fingertips. So you can just get comfortable on your couch and just check out all these different sessions. Again, I think we have a really great, diverse program with a lot of opportunities, given that we cover acute pain, chronic pain, regional anesthesia. We have speakers from all over the country, all over the world, really experts on all these topics. And also we have a lot of new faces that we're introducing as speakers as well. So it's not just going to be all the same people that you see. So you're going to meet new people, learn from new people. We also have the stand experts that you've seen and the faces you remember. So I think there's a lot of diversity, a lot of diversity with men and women and everything. So, I think it's going to be a really, interesting meeting, and it's, a progressive meeting. And I think everyone will find a lot of valuable information to learn.
And I just want to go ahead, Eric.
I was just going to, it looks like the entire meeting is basically Friday evening through Sunday, right? So it's all outside of work hours too. So it's worth pointing out for people that haven't registered yet, you're not going to be, you don't have to miss work necessarily, or you don't have to do things competing with clinical duties, which is something that you would not have in the in-person meeting typically.
True.
Yeah, and encourage people. I mean, having attended a few of these virtual meetings, and I think that all of us have sort of had mixed experience with it. I think the solution to the problem is actually dedicate time to attend the meeting, and don't try to do, stuff at home, stuff at work, and do 3 or 4 things. If you were going to a meeting, you would be attending, you would be present, you would be engaged. And I think that's where the value will come out of this is the content is just as good as ever, if not better. The speakers are just as good as, if not better. And I think that the interactivity can be achieved on social media, on the Q&A, on these interactive sessions, and some of the social events. It's not the same, but I think there's a lot that we can do better and get a lot out of this. So dedicate time to it, get yourself comfortable, participate in the ongoing conversation. I'll throw the hashtags back up here for people to remember. This is the great way to kind of keep track of the conversation going on the side. I like to call it the hallway conversation. It's what, if you were at the meeting, the conversations that would be going on in the hallways between sessions. The content is there. It's going to be in the sessions, but what are people talking about outside? That's going to be going on in social media. And so participate in that, watch it, read it, add to it. I think that'll be really a great way to connect with experts from around the world. And then Eric, just for you, James Kim said that he's going to try to find his didgeridoo for you for another musical component. James, that's a promise. I hope that I do expect to see that during the meeting. So, and the last thing, and I'm going to echo a comment that Hari's making here: get comfortable and get your questions ready. You'll get the most value out of this if you ask a lot of questions. The speakers are waiting for you to ask questions. Otherwise, it's going to be crickets. So get your questions ready. Ask a lot of questions. I think that's going to make the meeting even better. I want to thank both of you guys, not just for attending today for the podcast, but really doing the incredibly hard work over the last 6 months to change something that you spent years preparing. I think it's a testament to your dedication to this community and the material that you're presenting. It's so important, and I think everybody needs a real positive, uplifting experience with our colleagues and friends, and I think that you guys are preparing that. So I'm really excited, really proud of you guys, really happy to be part of this, and we look forward to it. So November 20th through the 22nd, but register today. Go to the website, ASRA.com.
Thank you very much. Thank you, guys.
Thank you, ladies.
Thank you, everybody, and look forward to talking to you guys more soon. All right, bye.
Bye. Take care.